Bismillahirrahmanirrahim. So now coming towards the morphology of the myocardial infarction. But before morphology, we must study that we must know that whenever there is ischemia, जब ischemia हो जाता है, so it will lead to necrosis. This necrosis will in turn lead to the stimulation of the inflammation, which is both type acute and chronic, and this inflammation will in turn lead to the healing, and healing will cause the scarring. Usually, the necrosis occur after the ischemia. From day 1 to day 7, there will be inflammation both of acute and chronic type, and after day 7, the process of healing will start, and this will continue from day 7 to 1 month. And from 1 month onward, there will be scarring of the myocardial infarct. So we will discuss the morphological features of the myocardial infarct on the basis of time. So let's start from 0 minute to 30 minutes. There will be no irreversible injury. The injury is only reversible. It can be relieved by giving nitroglycerin, etc. And there will be no gross or macroscopic features. From about 30 minutes to 4 hours, there will be no gross feature, but we can see on the microscopy that the myocardial fibers show the property of waviness. There is waviness of the fibers, it mostly at the borders of the heart. As you can see, there is waviness of the myocyte. Now from about 4 hours to 12 hours, the gross feature become visible, and it is in the form of dark discoloration of the heart, and this dark discoloration is mainly due to the blood oozing out from the capillaries, and on microscopy we can see that the coagulative necrosis starts. From about 4 hours to 12 hours, the coagulative necrosis starts. There is edema, there is hemorrhage in the form of blood, and you can see the coagulative necrosis starts here. There is edema between the edematic fluid between the myocyte fibers, and you can see that in some myocyte there is no nucleus, and this is mainly due to the starts of the coagulative necrosis. Now from about 12 hours to 24 hours or after 1 day, the gross feature is the same, that there is dark discoloration of the heart due to the blood, and the coagulative necrosis is marked and characterized by the pycnosis, karyolexis, karyolysis, and all of these result in the loss of nucleus. You can also see that there is a contraction band necrosis. What is contraction band necrosis? We will study it later, but remember that there will be contraction band necrosis and coagulative necrosis marked by the pycnosis, karyolysis of the nucleus, and this will result in the loss of nucleus. You can see some myocytes have no nucleus. Also there is the normal myocardium tissue consisting of nucleus and normal myocytes. All these have nucleus, and in this side there is no myocyte, there is no nucleus in the myocyte, and you can see that there is a contraction band necrosis. These are all the contraction band necrosis, and these are the myocytes containing no nucleus. There is no nucleus in the myocytes, and this is the red dark discoloration of the heart due to the myocardial ischemia. Now from day 1 to day 3, the color of the heart become yellow paler, and this is due to infiltration by the WBC. From day 1 to day 3, there is marked by the acute inflammation which is stimulated by the coagulative necrosis, and this acute inflammation is characterized by the neutrophil infiltration to the myocytes. You can see the neutrophil infiltration, and it is much more from day 1 to day 3. Now from day 3 to day 7, the color of the heart is same yellow paler, but the acute inflammation is converted into the chronic inflammation, and the chronic inflammation is characterized by the macrophages infiltration with marked myocyte phagocytosis caused by these macrophages. As you can see, This is the macrophages infiltration, and they cause the marked myocyte phagocytosis. As you can see, these are the normal myocytes, and here you can see the myocytes are already or almost phagocytized by these macrophages. And you can also see the yellow center having a hyperemic border. These are the yellow center, pale center due to the WC infiltration, and this is the hyperemic border. And this hyperemic border is much more pronounced from 1 week to about 3 weeks. 1 week to about 3 weeks. You can see on the grass picture that this is hyperemic border with depressed infarct. This is a depressed infarct having hyperemic border, and this hyperemic border is mainly due to infiltration of the blood vessels from the surrounding normal tissue. And on the microscopy, you can see that there is marked granulation tissues from week 1 to week 3. As we've already discussed, from week 1 to week 3, it is to 1 month. It is a process. There is process of healing. So there is marked granulation tissue when seen on the microscopy. You can see the granulation tissue characterized by the abundant capillaries and a lot of loose connective tissue. These are the abundant capillaries, and in between there is a lot of loose connective tissue. From 1 month to 2 months, the infarct becomes gray-white scar, and it is mainly due to increased collagen synthesis and decreased cellularity. And beyond 2 months, there is complete scarring of the infarct, and microscopically it is characterized by the dense collagenous scar. As you can see, there is the dense collagen, and in between there is much less or few residual myocytes. And this is the picture or gross picture of the scar.